And if you're considering to have a procedure done, what are some of the questions you would tell your patients to ask themselves?
Ask themselves? Well, motivation. What is the original reason why they've come for it? You know, if you are a level-headed person, it's easy, you know, but we aren't all as level-headed as we like to be.
Yeah.
You know, there is no such thing as normal, there is only life. It's the motto that I like to go by. And it's true. You know, what we perceive as normal, we need to see, all right, is it culturally normal for me? Is it culturally normal for you? So no, that's not really something that they should ask themselves, I suppose. You should rather say, am I doing this for the right reasons? You know, do I want to do this for myself? I'm not doing it for any other reason other than I want to feel better about myself. And I think that's the main question they should ask themselves.
Do you find sometimes you have patients who come in and they're not doing it for themselves?
Yes, you do. And those are probably patients we should avoid. If someone comes into me and they say to me, all right, the reason why I'm doing this is because my husband or my boyfriend or vice versa is forcing me to do this, I would definitely be inclined to say, no, I think you need to put this out, rethink it and come back when you change your mind, or maybe they should see a clinical psychologist.
Okay, and what kind of questions should patients be asking their doctors?
Most doctors who are going to be performing an operation will go through all the complications. Those are very important that you go through, all right. Managing a patient's expectations is very important, okay? So what result are we hoping for? What are we going to achieve? You know, a patient comes in and says, I want this result, then you need to say, all right, that is either attainable or it isn't, okay? And it's very important to communicate very well with your patients. You know, knowing beforehand what we expect the result to be is probably the most important thing that you need to leave that first visit with, is having a clear objective of where we're going and what we will achieve.
Do people often come in with unattainable expectations?
Absolutely.
Yeah.
You know, it's very common where they come in and they want something, you just say, look, this is surgery after all. You know, you probably are going to be left with bruising and scars. And I think a lot of people downplay cosmetic surgery. They think, oh, it's not such a huge surgery, it's not so big, it's not going to have such big complications, the downtime's not going to be so big, but it's still a big procedure, you know. And then they leave the operating theatre and they wake up and they recover for up to 6 weeks, some of these procedures. So that is a massive hurdle they need to get over, is to realize that even cosmetic surgery is not minor surgery. It can be very big. Obviously there are smaller procedures, but there are some procedures that are so big that they're always so surprised afterwards. You know, oh, I didn't know I was going to be so bruised or so swollen.
What is the main motivator for the patients who come into your office?
Probably age-related changes in women, but having said that, of course, we have a lot of young patients who come for, say, breast augmentations or rhinoplasties or bat ears. So I'd have to say maybe it's socially related